positional release technique, cervical spine. The session is there. Patient, and for these, and let me tell you, for all the positional release techniques, we have the tender points. And we are practicing on those tender points only. For example, if I have to talk about flexion strain, the patient says, गर्दन नीचे झुका रहे, किताब पढ़ता हूँ, मोबाइल यूज करता हूँ, पेन आ रहा है. Fine. For flexion strains, the tender point will be along the transverse processes. Fine. That will be along the transverse process. You need to feel the transverse process, and mind it, higher the cervical region, add more of rotation. Lower the cervical region, add more of flexion. For example, 2, 3, 4. If we are treating for 2, 3, 4, we will be adding more of rotation along with the flexion. But if it is C5, 6, 7, we will be adding more of flexion instead of rotation. Am I clear? Okay. Now flexion strain. Patient says C4, 5, pain aa gaya. Is it correct? Visible? Everyone?
Yes, sir.
Okay. Now it is moving down. You can add either way side flexion. Along with the patient, watch the patient apprehension, ask him, dard mein farak hai, aram hai? Patient says, yes, I am fine. Now it's up to you to add up the rotation component. ठीक है? Now the patient says, वही range थी जिसमें उसको pain था, but मैंने अब उसमें components add कर दिए. Now this is my position of comfort. And here it is now feeling this tender point. Here what I'll be feeling along the 90-second is the easiness or the reducing of the tone of the muscle or the fascia involved. Okay, now what you have to do is, if you're a strong therapist with nice wrist, good elbow and wonderful shoulders, only your job is to hold this neck for 90 seconds. Am I clear?
Yes.
Am I clear? Yes or no?
Yes, sir.
Good. This was transverse process for the cervical flexion strain. If I talk about extension strains, गर्दन पीछे कर रहे हैं, दर्द आ रहा है. Fine. For extension strains, the tender point will be along the spinous processes. Fine. And now you need to palpate and feel the spinous process. Spinous process feel किया. Patient कह रहा है यहाँ पे आए. Sir, डॉक्टर साहब pain है. Fine. Now what I do is I'll just mobilize it. Now I'll try to find out the position of ease. Either way side flexion. That's our pain बढ़ गया. Stop it. Either side flexion. I'm fine. Much better. Not feeling that much tenderness. Okay. Now you can add up rotation components. It's not mandatory to add it. It's not mandatory. It's up to you. Fine. And you can, with this only, you can rotate on the either side also. Clear? Maintain this position for 90 seconds and go for the patient apprehension. Same way, side flexion strain, that is along the articular processes of the cervical spine. Maintain it, palpate the articular process. Side flexion से साफ pain आ रहा है. Fine. Immediately add flexion component. थोड़ा फर्क. Rotate it. ठीक है? Side flex तो ये था ही. Now you have to add up the rotation component or the flexion component. Either of these. Maintain it, sustain it for 90 seconds, and you will listen. Thank you, Dr. Saab. ठीक है?
Yes, sir.
You want me to repeat or is it okay? Repeat or okay?
Okay.
Okay, sir.
It's fine. Patient problem, pain, झुका, कमर में आया. अब मुझे क्या करना है? What I do is I go with this thing only. Exaggeration of the distortion. This was distorted. Replication of the strain. I bend it here. What I do is I added side flexion component. I added rotatory component, and that will be in the supine position. Fine. Or I can go with the side flexion and rotation. Clear? Maintain this position, and that's how you attain you relax the hyper irritable source. Thank you, Dr. Saab.